All right, so I'm going to share with you a few tips that will help with boosting your confidence, because I know a lot of times, we tend to lack confidence, and so we don't get the job done the way it is supposed to be done. Especially our new grads who are going out there, this is something that you definitely need to have. So hopefully these tips will benefit you, and hopefully you'd have already started to implement some of them in your daily habits or your daily life. All right, the first thing I want to say is go ahead and see yourself as being successful. Visualize yourself as being successful. If you're able to tell yourself that, you're going to make it in your life. You understand? The second thing is to dress the part. Make sure you're acting professionally and you're confident when you get out there. The third thing is make sure you're asking questions, because a lot of times you think you might know, but you don't know. When in doubt, it is okay to go ahead and ask questions, because when you ask questions, it shows that you're interested and you're trying to learn. It shows that you're growing. And so that is very good. Another thing is that you want to have a mentor. Get a mentor, because when you have a mentor with you, they're able to help you, guide you, and they're able to see your growth as you go along in your journey. Another thing is definitely go ahead and prioritize your self-care, because self-care is very important, and a lot of times that is something that we don't focus on. But especially when it comes on to sleep, prioritize that, because lack of sleep will kill you. Yes, lack of sleep is very dangerous, and you definitely want to make sure that you get enough sleep so you can go out there and confidently do your job and be you. The next thing is definitely stay educated, because every day things change. You understand? You have improvement, you have best practices that are out there, things are just changing, and so you want to make sure that when you go out there, you have the right information. The next thing is to make sure you're learning from your mistakes, because mistakes do happen to the best of us, and it's our responsibility to go ahead now and learn from that mistake. So try not to make the same mistakes over and over again. Try to make sure that you're learning from your mistake. Other thing that I definitely would say is make sure you're communicating effectively. Make sure it is clear. You understand? Make sure that both of you do understand what you're saying, because at the end of the day, if you don't understand it, things are going to be happening. And so I just want to leave those tips with you, because I just feel as though as a nurse you definitely need them, and not only as a nurse but as a professional in whatever area you're in, you definitely need to stay confident at all times, and I think these will benefit you. Let me know what it is that makes you confident as a nurse or as a professional in the comment box below, and I'm just excited to hear yours. I try to incorporate everything, but when it comes down to being a nurse, I try to be prepared, because we know me I deal with patient life. You understand? I know that I'm dealing with patient life, and if I am well prepared as a nurse, I think I will do my job confidently, because I am ready to take on the work of the day. And that is just my top tip that will boost my confidence. I do hope you will have a wonderful day and enjoy. Remember to go ahead and subscribe and follow me here on TikTok at Think Nursing 1, on YouTube at Think Nursing, and that's it. Until then, I'm out. All right, so usually when I was with another company and I was doing my own billing, I usually go in to see the patients and do their annual visit. Nobody would tell me that basically I'm doing 2 visits in one, but the company is only paying me for 1 visit. Meaning they will give you the flat rate to see the patient, and that's it. But you go in, you hear that the patient having diarrhea, abdominal pain, you're doing a sick visit as well for that patient. And not only are you doing a sick visit, you're also doing an annual wellness visit at the time of the exam. So you're doing 2 visits in one. I don't know how many persons can recall going to do their regular checkup with their doctor, and if you need a little prescription for something that is not related to your annual visit, you'll hear that you have a co-pay, because it's 2 different visits in one. I always struggle and argue with the office regarding that, because me already here for annual wellness visit. I thought it would have been a case where I could just go ahead, see the doctor, and they prescribe whatever it is that I need, or me talk about what additional concern I had during the visit with them, and they will just go ahead and address it. But no, they're doing the annual wellness, and they're also doing an office visit or a sick visit. And it's the same thing as a house call nurse practitioner. Now I am able to do my own billing. So guess what? Now that I'm going to see my patient, I have to enter the code for the annual wellness visit, and I also have to put in a code for a regular follow-up. So for example, you were being paid $10 a flat rate for the for the visit. No, you're able to put in your different codes because you're billing based on what you're doing. And so you're able to bill for your follow-up to deal with the concern of the patient regarding the diarrhea, abdominal pain, and everything. And you're also able to do your billing for your annual wellness visit. I hope this makes sense, but it makes sense for me now. So now when I go to my doctor's office, I won't be asking why you need to do that. I'm just going to go ahead and be like, okay, no problem, because I have a better understanding, because that's how they're billing. So this just leaves me to think that companies are out there just paying you the flat rate, but they're going ahead and doing the annual wellness visit and a sick visit or follow-up visit and billing those two, so they're making bulk off of your work. You understand? So as I say, if the company can allow you to do your billing, go ahead and do it, because you will see what you are worth. You are going to be able to make sure that you get compensated for the work that you're putting in to see these patients. Because on a 1 or 2 patients I go out there and see as an annual visit, and I tell you, when I finish listening to some of these concerns that the patient have, those could have taken up about 5 different visits. But because they're paying you only one, and you, so when you don't know things, you go out there and you just go ahead and do everything that you're supposed to do. When I say it's supposed to be, you understand? That's not how it's supposed to be. So make sure you understand. I hope my information that I'm sharing here is going to be helping you going forward, so that way, you know, people don't rob you of your money and your time. I just hope that the information that I'm sharing here is beneficial, and you know, you will go out there and see your worth and make sure that persons are paying you for your time and the effort that you're putting into seeing these patients. Because a lot of times you are doing all of this work, but you're not seeing the money. You're not seeing the money in your hand because, you know, there are so many undercover things that we're not aware of. And, you know, and that's why you see right now, it's very important. There's so many undercover things that you're not aware of. And so for me right now, it is important for every nurse practitioner out there to go ahead and do that billing and coding course that they always have offering, even if you're not opening your own practice. But at least you'll have an idea of how we go about with billing and coding. Because even though me just get a little bit of it, me just understand it a little, I'm telling you that I am gonna go ahead and invest into doing that billing and coding course, so me can have a better understanding. So when me go out there, I can know that when I talk to a patient regarding smoking cessation, when me talk to a patient about advanced directive, and when me sign off on anything looking like that, then definitely me can go ahead and bill for it, because there is a code for that. Bet you never know that. Bet you never know it. Now you know. All right. So anyways, I do hope you guys are having a wonderful day. Remember to check out my YouTube page at thinknursing.com. Why am I saying .com? But check out my YouTube page at Think Nursing, and follow me here on TikTok at Think Nursing 1, where I share just general information regarding nursing, travel, and lifestyle. But a vast of the information is always going to be surrounding nursing. Till then, I will see you in the next video. Bye. So I'm sitting here laughing because I saw this young lady posted, you know, a comment under my video regarding the pew-pew. Yeah, man, that pew-pew issue. She was asking to... Well, she wasn't really asking. She wants me to talk a little bit more about the pew-pew issue, because she's going to be starting house call service in a few weeks. But the part that, you know, I'm wondering if she's going to understand is when, for example, I meet a patient and I don't feel as though that patient is fitting for me. I'm not suitable for that patient. Meaning, I go to the patient's home and it is in a deplorable condition, or the family member is threatening. All of those things. You go there, you see cockroach. You go there and you see dog stool, cat stool. All of those things that are happening. And I put in my note that, yeah, this is it. This is the situation. And, you know, I'm not going to coming back. I'm not coming back to that home, because I don't think anybody should be experiencing it. We need to figure out how we're going to get this patient's home cleaned up. And so you realize, as a nurse practitioner, what happens is that they take the patient from you, and then what they do is they put it to somebody else, because money have to make. Money has to be made from that patient. So you are scared about the pew-pew. What you need to be scared about is all of these cases that I'm telling you about, that Tom, Dick, and Harry and myself have gone to 1 or 2 times and have no interest in going back to. Just remember that if you haven't met on that patient and you see the name, you might not know what is going on, because, as I say, house call is very unpredictable. The way we document things, or some persons document things, it's not a true reflection of what exactly is going on. And so you might be there reading, and then only to find out that on the day of you visiting the patient, you will find somebody that is not in, you'll find somebody that you don't really want to visit because the place is such a hot mess. So yes, be concerned about the pew pew, but also be concerned about all these other cases you'll hear people talking about that we put aside because it is not conducive for you to go there. You don't have the resources to go there. So just remember that you're going to meet upon 1, 2, 3, or 4 of them before you can actually say, yeah man, this is what house call service is all about. Because they're out there. They're in the service just going around like this because companies are not going to discharge them. They're not going to discharge them because, you know, money have to come in. And there's always somebody out there that will do the job. So just imagine if they have 10 nurse practitioners, 10 months worth of work that. You understand? Because if they move it around to everybody, you understand, one at a time, and you go there and you refuse it. Yeah, it's okay to refuse patients if you don't feel as though you're properly geared up. If you don't feel as though you're comfortable with whatever situation is, it's okay to refuse it, but you won't be able to refuse it until you actually go and visit the patient. You won't be able to actually refuse it until you actually go in and see the patient for yourself and then come to a conclusion that that's the last. All right, but definitely you will go out there and you'll see a lot of things regarding the pew pew. I will talk about that in another video, or I'll just respond to your video or respond to your question regarding that. But thank you so much for tuning in and bearing with me. Information that I am sharing with you is to bring awareness as to what me is experiencing, what other persons are experiencing. It's not a matter of mocking, laughing, or making a joke out of it, but it's the reality of what persons are living in, going through, what nurses are dealing with, home health nurses are dealing with on a daily basis, that we need to bring awareness to. So some of us can actually, you know, make some changes in our life, make some changes in the house. You understand? To accommodate us so we can give best care, because that is what we aim to give. All right, so please remember to go ahead and subscribe to my YouTube page and follow me here on TikTok at Think Nursing and on YouTube at Think Nursing 1, where oh no, the other way around. So follow me here on TikTok at Think Nursing 1 and subscribe to me on YouTube at Think Nursing. And I will see you in the next video. Bye. Bye. So this is the second time I'm experiencing a situation where, you know, the last patient of the day is the one that hurt you. The last patient of the day is the one that mash up your day. Meaning, you know, sometimes I ask you to do one little favor. Go ahead and be like, yeah man, I'll do it. I'll go ahead and do it. Because when you look, sometimes it's not going to take anything out of you. But when you go to your work, you work the hardest throughout the day. And that is a situation with a patient. They called me and asked me if I could see a patient. And I say yes, right? So I decided to go and see the patient because it was in the close proximity. And when I went there to see the patient, I'm going to say, son, hot out the door, you know. The temperature is 101 degree. It's 101 degrees right now, so it's hot and I'm wearing my jacket. So I got out of the car and start walking over to the house, and I hear some dogs inside. But me and dog are not friends. We're not friends like that. The lady came and she pulled up the door behind her. But that is the best thing she could have done for me for today. So in as much as the patio never have anything to, you know, put my bag on, and it wasn't really covered properly, may I tell you, say, it saved me. Her stepping out, pulling up the door behind her, and she says, just be careful, do not sit, because that chair is not good. So we can have the evaluation outside here. So I said, okay, that's fine, that's fine. We're on the patio, and while I'm on the patio, guess what bite me? Mosquito. A long time I don't see mosquito bite now. Mosquito not start bite up my foot, man. What me tell you, say? I am there just, you know, using my hand, going like this, because mosquito bite me on my face and the mosquito bite me on my leg. So I'm like, oh Lord. You know, but anyways, I am just sharing my stories here with you guys so you can be aware of what is out there. You know, it's the good, the bad, the ugly, everything that comes with house call service. I try to just share it here. So it's not all about, you know, the bad stories. I'm definitely going to be sharing good things about house call service, or things that will help you to make your decision if this is something that you want to explore a little bit. But definitely, you know, feel free to go ahead and ask me any questions. I'm more open to answer anything that you ask regarding, you know, nursing. So feel free to go ahead and just share your insight as well on the topic, especially if you're nurses or a house call nurse practitioner. Definitely go ahead and just share your insight on your experience working as a house call nurse practitioner in whatever state you're at. All right, so thank you so much, and I will see you in the next video, and I do hope you guys will have a wonderful day. All right, bye. Definitely, we need to be very careful because this job is very risky. It is very risky in all aspects. You understand? And when it comes down to safety, when it comes down to safety of the nurses, the persons that are going out there, the LPNs, the caregivers, when it comes down to safety in these homes, that is very, very important, because we're not doing any background check on these people. We're not doing background check on these people, you know. We're just getting a call to say that this person needs a visit. We don't know if the person is a pettifier. Don't know anything about these. And so for persons who are doing admissions out there, I'm not saying we're not doing a good job. I'm just saying it's nice for you to go ahead and document as much as you possibly can to let persons be aware of what they are entering into, because that very, very first admission is the admission that is going to paint a picture of what the home environment looks like, what the resources looks like, what the family support looks like for these individuals. Because mark you, some homes do have additional relatives there that you're not going to be feeling as though you're alone in these dark places, and so it's okay. But then again, you have some homes that are totally like, you know, it's just one person there. It's just one person there. It's the patient, and you don't know. And you know, the encounter with the pew, it wasn't just the one pew me encounter. I've seen it a lot of times where our elderly folks are holding on to these things because they're the only person that is living in their home. They're the only person with their wife that is living in their home, and they're scared. They're scared. So a lot of times you realize, you go, they have it with them, because they are just there waiting, because they are feeling as though persons are entering their homes and wanting their belongings. So they have their little pew there. You understand? They have it there with them. So definitely, I encourage nurses, when you go out, make sure you have a tracker in your car. Make sure you have a tracker upon yourself. You know, figure out how is it that persons are going to be aware of where you're at, because you want to be a case where if something happens, them know which part it did last day. You understand? You don't want to be a case where you just go out on the road, and a lot of times you go out and we're alone, because as us call nurse practitioner, you don't have a medical assistant, you don't have a driver, you don't have anybody with you. You understand? So kudos to the companies out there that are providing drivers for these nurse practitioners to go to homes of these patients and see them. You understand? Because as I say, we're not doing any background check. We're not getting a true picture of the patient. We just know that these patients are sick, and we just take up our bag and we go out there. We run out there, you know. We run out there to these homes. So we have to be very, very careful. And I wish that a lot of house call service companies will go ahead and try to implement something in place that will help their providers to be a little bit safer. You understand? Help their providers to be a little bit safer, because that is the only way you can ensure that your caregivers, your providers are safe in these homes that is bringing in money to you. So kudos to those companies. So if you're a nurse practitioner, you're going out there to find a job, and you're looking for a job for, you know, house call service, find a company that is going to give you a driver or a medical assistant, or at least somebody to be with you on those trips when you're going in to see these patients, especially if you're seeing a lot of patients. Definitely, it will be very important for you to go ahead and get one of those companies. All right.